As we have discussed earlier, current breast MRI exams present a large volume of image data for the interpreting radiologist to organize and evaluate. We feel that it's critical to develop an organized and reproducible approach that you can follow with every case. A CAD system can facilitate this process. In this section, we will show you our approach to each case and how we organize the data presented. We will provide some explanation as to why we have come to this method, and perhaps this will help you develop your own system or possibly modify existing ones. Throughout this course, we try to demonstrate a range of imaging techniques from very basic protocols applicable on every entry-level or older 1.5 Tesla MRI platform to more advanced protocols requiring higher-end MRI equipment. Our reason for this is that we feel that diagnostic breast MRI can be performed at any of these levels. You should not be afraid to begin breast MRI because your magnet has limitations. Certainly, the more advanced protocols do have advantages, but we performed a large number of cases with very basic imaging protocols and still yielded very good statistical results. The approach to image interpretation that we will elaborate on in this section will generally apply to all levels of protocols. We feel that the evaluation of the 1-minute subtraction MIP image is critical to every case and is the optimal place to begin your review of each exam. This image enables you to quickly get an overview of the parenchymal enhancement. By looking at the 1-minute subtraction MIP, you are at the optimal phase of tissue enhancement to separate pathologic enhancement from physiologic enhancement. As you can see on this 1-minute subtraction MIP image from our basic 2D gradient imaging protocol, there is no significant enhancement within either breast. You can see minimal linear enhancement in the medial left breast secondary to a small amount of vascular enhancement. Instantly, you have an overview of this case. Again, utilizing our standard 2D gradient technique, you can see immediately on this 1-minute subtraction MIP that there is significant asymmetric early enhancement within the right breast. This is clearly pathologic. Again, immediately you have an overview of the case, knowing instantly that a pathologic process of some sort is involving the right breast. Here we demonstrate an axial parallel imaging protocol. This 1-minute subtraction MIP demonstrates background enhancement of moderately dense fibroglandular tissue. The enhancement is symmetric, without dominant focal or asymmetric regional area of enhancement. In this 1-minute subtraction MIP from an axial parallel image acquisition, you again can instantly detect pathology in this patient who has had previous right breast lumpectomy and radiation therapy. There is multifocal abnormal enhancement in the right breast, clearly pathologic and evident immediately on the initial MIP image. Here, demonstrating a sagittal parallel imaging protocol, you can again see with the 1-minute subtraction MIPs symmetric vascular enhancement with minimal background parenchymal enhancement. There is no significant asymmetric focal or regional enhancement. A small area of enhancement centrally in the right breast was ultimately shown to represent a small intramammary lymph node. In this 1-minute subtraction MIP evaluation, you can see a background micronodular pattern of enhancement within the breast, which is not out of the range of normal and suggests mild fibrocystic change. Immediately, however, you can identify an asymmetric, irregularly marginated dominant focus of early enhancement inferiorly in the right breast. Immediately, you have an overview of the parenchyma of the breast bilaterally and can easily detect a region of enhancement strongly suspicious for malignancy. We also feel that it is critical to simultaneously image both breasts and to evaluate the 1-minute subtraction MIP simultaneously as well. This symmetry or lack of symmetry can be critical to the detection of many forms of pathology. As illustrated in this case, there is diffuse micronodular enhancement within the breast parenchyma. It is, however, noted to be symmetrically distributed within the breast bilaterally without a dominant focus of abnormal enhancement or asymmetric regional enhancement. This is fibrocystic change. It is critical to evaluate the breast bilaterally and very early on in the parenchymal enhancement. Here is again demonstrated relatively diffuse, non-mass-like enhancement within the right breast. What is its significance? Now when comparing the left breast and simultaneously evaluating the 1-minute subtraction image, you can see this has pronounced significance as it is markedly asymmetric. Color parametric mapping demonstrates abnormal regional enhancement kinetics inferiorly in the right breast. This was ductal carcinoma in situ. It is critical to simultaneously evaluate the breast bilaterally at the 1-minute post-contrast phase of imaging to make this diagnosis. As you can see in these examples, the relevance of enhancement can change dramatically depending on whether it is symmetric or asymmetric. The next series of images that we evaluate are the 1-minute fat-saturated thin MIP images. We find this sequence useful again as an initial overview, only with more anatomic detail provided. This image analysis is useful only with protocols utilizing a fat saturation technique. We have designated a thin MIP slice thickness of 1.5 centimeters. This was somewhat arbitrary. However, after evaluating multiple slice thicknesses, we felt this gave a very nice, somewhat three-dimensional overview while allowing us to step sequentially through the breast tissue. This is an example utilizing the axial parallel imaging protocol. Here we demonstrate again the 1-minute fat-saturated thin MIP acquisitions with a sagittal parallel imaging protocol. Be sure to design your hanging protocols to again image the breast bilaterally and simultaneously as you survey the parenchyma. After obtaining an initial overview of the case with the 1-minute subtraction MIPs and the 1-minute fat-saturated thin MIPs, we actually begin our dictation with initial overview of the unenhanced anatomy of the breasts, the axilla, and portions of the chest. Whether you use a T2 fat-saturated or stir sequence can be a personal choice. We, however, have found stir imaging to be very useful as a sensitive and reliable method to detect cysts, subtle asymmetric edema, as well as the signal characteristics of some pathologic entities. You do not have to deal with instances of heterogeneous fat saturation with stir imaging. The T1 sequences are performed at a higher resolution than the stir imaging, generally at 2 to 3 millimeter slice thickness. It is useful for evaluation of the breast anatomy, especially lymph node anatomy, both axillary and intramammary. Linking these two acquisitions allows an overview to evaluate the amount of breast tissue, macro and microcystic changes, parenchymal or skin edema, as well as lymph node morphology. In addition to simultaneously evaluating axial stir and T1 acquisitions, we will generally display as well a sagittal acquisition, which is usually performed at a high resolution. This can be performed with or without fat saturation. A CAD system can also facilitate cross-referencing a region of interest on your multiple orthogonal acquisitions. Don't forget on this initial unenhanced survey to look into the chest for additional information. Once we have completed our unenhanced overview of the breast bilaterally, we then proceed to evaluating the raw data from the dynamic acquisition. We will evaluate the 1-minute post-gadolinium image as well as the 1-minute subtraction individual slice data. Here, we demonstrate this phase of our image interpretation utilizing the standard 2D gradient non-fat saturated imaging protocol. As we have no fat saturated image, we do still evaluate the raw data with pre- and post-contrast images viewed simultaneously, along with the individual 1-minute subtraction image. In this particular hanging protocol, we also demonstrate the 1-minute subtraction MIP for a continual overview of the case. Here we demonstrate an axial parallel imaging protocol with the actual individual 1-minute fat-saturated slice sequence on the left and the corresponding 1-minute subtraction image on the right. This is where your detailed analysis of the exam begins, image by image. Finally, we demonstrated an evaluation of the individual post-contrast images using the sagittal parallel imaging protocol. Again, we always evaluate the breast simultaneously. In this hanging protocol, we place the right and left 1-minute fat saturation acquisitions back to back. Below this, we place their corresponding 1-minute subtraction acquisitions. As you are evaluating in detail, slice by slice through the parenchyma, color parametric mapping can be applied to evaluate the slice by slice enhancement kinetics. As we are evaluating the information on each individual slice from our first post-contrast image acquisition, we design a final hanging protocol to simultaneously display our additional orthogonal unenhanced pulse sequences to allow for slice-by-slice cross-referencing to evaluate the signal characteristics of any suspicious foci of enhancement. Hopefully, this discussion will have been of benefit to you as you sort through and try to develop your own approach to image interpretation. Regardless of the method that you ultimately decide on, we do feel that it is very important that you develop a systematic approach that you utilize with each and every case.